Being cautious with hormone therapies, especially hormone replacement therapy, HRT, used during or after menopause, is an important and nuanced part of cancer prevention. While these therapies can offer meaningful relief from symptoms like hot flashes, bone loss, and mood changes, they also come with complex biological effects that influence cancer risk. When used long-term, or without appropriate medical guidance, certain types of hormone therapy can increase the risk of hormone-sensitive cancers such as breast, ovarian, and uterine cancer. Understanding the balance between benefits and risks and tailoring treatment to individual needs is key to using these therapies safely and effectively. At the heart of the concern is the way external hormones interact with the body's own hormone receptors. Estrogen and progesterone are powerful regulators of cell growth, particularly in tissues like the breasts, ovaries, and uterus. When hormone levels are elevated, either naturally or through medications, they can stimulate cell proliferation in these organs. Over time, and especially with long-term exposure, this stimulation can increase the likelihood of genetic errors during replication, contributing to cancer development. This effect is most evident in combined estrogen-progestin therapies, which have been linked to a significantly higher risk of breast cancer when used for more than 5 years. Estrogen-only therapy, often prescribed to women who have had a hysterectomy, carries a different risk profile. It is less strongly associated with breast cancer, but may raise the risk of endometrial, uterine cancer when the uterus is still present. Ovarian cancer risk is also a concern, albeit to a lesser extent. Some studies have suggested that even short-term hormone use may slightly elevate risk, though the absolute increase is small. The biological mechanisms are still under investigation, but it is believed that chronic hormonal stimulation may contribute to inflammation or alter the natural apoptosis, cell death, process, allowing abnormal cells to persist. While the overall risk remains relatively low, it becomes more significant in women with genetic predispositions or a personal or family history of hormone-sensitive cancers. That said, hormone therapy is not inherently harmful. In fact, for many women, it provides substantial improvements in quality of life, reducing the risk of osteoporosis and improving sleep, cognition, and cardiovascular function when used appropriately. The key is personalized treatment, taking into account a woman's age, health history, symptom severity, and cancer risk factors. In general, hormone therapy is considered safer when started close to the onset of menopause and used for the shortest duration necessary to manage symptoms. Lower doses, transdermal applications, such as patches, and bioidentical hormones may offer additional safety, though they still require careful monitoring. There are also safer alternatives or complementary strategies for many women. Lifestyle measures such as maintaining a healthy weight, exercising regularly, reducing alcohol intake, and managing stress can all help ease menopausal symptoms and reduce the need for hormonal intervention. Phytoestrogens from soy, flaxseed, or red clover may offer mild symptom relief with a much gentler impact on hormone receptors. Though not as potent as prescription hormones, these natural compounds can be beneficial, especially when used early and consistently. Importantly, any use of hormone therapy should be undertaken with ongoing medical supervision. Regular breast screenings, pelvic exams, and discussions about symptom changes help ensure that benefits continue to outweigh risks. Women with a strong family history of breast or ovarian cancer, or who carry BRCA gene mutations, should be especially cautious and may need to consider non-hormonal options entirely. Being cautious with hormone therapy isn't about avoiding it altogether, it's about using it wisely. With individualized planning and periodic reassessment, many women can safely benefit from its advantages without significantly increasing their cancer risk. When approached with awareness and guided by evidence, hormone therapy can be a supportive bridge through menopause rather than a hidden health hazard. In the broader picture of cancer prevention, it is one more opportunity to align medical decisions with long-term vitality, ensuring that relief today doesn't come at the cost of tomorrow's health.